So for the complicated cases, does a surgeon take the whole day? Is it a 2-day process, or is it a couple hours? Like, what's the timetable here?
It depends on what's needed. In cases where we may do different stages, where we come in from the side, like one of the cases that I showed you earlier, and then the back, I typically will separate that by a day. So that first surgery may only take a couple of hours, but the second surgery is much more involved. It may be 6 hours, it may be 8 hours, it may even be a little more. And so it's easier on the patients to separate that, where there's one component we can do ahead of time and then the other component. It really depends. But it's a very good question. And generally I stage them back to back by a day. I don't think there's any real consensus on that. I have some colleagues that will separate it by a week, keep people in hospital for a week between stages. Some people do a couple of days. It's sort of all over the map. I've been doing that by a day for years. I've had no problems, and I think it gets people going a lot quicker.